Hi everyone. So I originally posted the health assessment video and health interview for a class that I was taking, a health assessment class in my master's in nursing education. And I was humbled by how many views it got. Even though it was even a couple of minutes, it was amazing to see how many people actually viewed it. And after I took the class, some of my other classmates have been calling me to ask me how to prepare for that health assessment class. And so I figured if they're calling and trying to figure out how to best prepare for that class, it's best if I just, shoot another video to show what I learned and how to best prepare for it so it doesn't become as stressful as it was for me to create that video. I'm fairly new at this, so just be patient with me as I shoot this video. I have some notes that I'm gonna help use to guide me in my video. So this class was a 7-week course online. I'm taking my master's in education in nursing, and so it was a 7-week health assessment course that I had to upload a video, YouTube video of me doing a health assessment and a health history intake of a patient. So the first tip that I would give for someone that's going to be taking a health assessment class online and going to be doing something similar to what I did is as you're taking the class and as the class is progressing, you want to take notes of each chapter that you're reading, whether it's the heart, the lungs. Take notes of what's normal and how to document that so that when you actually go to do a health assessment or a health history, you know what to ask, and you're not having to go through the book to figure out what to ask. It's more of a condensed version, and it's in your words, and so it's a lot easier to follow. One of the things that I did in the video is I set up my equipment so that it cued me as to what to do next. So I think one of the first things that I put on my table of equipment that I used to do my health assessment was my stethoscope and a blood pressure cuff. I'm not really good in front of the camera, and so I was a little nervous, and of course I do health assessments on my patients all the time, but in front of the camera I really don't. So when I would look at my table, I knew what to do next, whether I was going to test your cranial nerve. I had my sample of my coffee or alcohol, an alcohol swab that he needed a smell or something like that. So it just kind of cued me. So really set up your table so that it cues you as to what to test next or what to assess next. One of the things that I also did to prepare beforehand is I made photocopies of some charts or pictures from the book that I used, and I wrote all over them, and then I posted them on the wall. So as I was looking at the patient and practicing what I was going to say before I shot the video, I was able to look at the wall and just kind of run through what I was going to say, what I was going to ask, what I was going to look for, to kind of cue me as to what to do next. This is also really good for visual learners, so that you can, as a visual learner, you can take a mental picture of what's on the wall, and you can kind of guide yourself through your assessment if you're going to do video. One of the tidbits that I have learned from people from other nurses or professionals in the education profession is to just look professional. So, get a lab coat, have everything ready, set all your equipment up beforehand before you shoot, make sure there's adequate lighting, that you're speaking loud enough to be heard, and just really practice before you actually shoot the video. Practice beforehand. Practice each time that every time you're reading the chapter. Say you're reading the chapter over the lungs, and get yourself, your husband, your wife, your child, a friend, and a classmate, and practice on them, and record yourself doing it so that you're less nervous in front of the camera the day of your actual 30-minute video. I used my iPhone to shoot my health assessment, and just make sure that you create enough space on your phone beforehand. Dump all your photos so that you're not shooting your video and then it cuts off. So that's a really good tidbit, because you're going to be focused on doing a good health assessment the day of, and not have to worry about having enough space and then going to your phone and then realizing that it didn't record half of it. Yeah, so that's pretty much all I can think of right now. I have all the forms that I used. I made up my own health assessment form from my book and what I read. So if you want to have a copy of the form that I used, my health assessment intake form, shoot me an email. I also have pictures of what I used, and I propped up on the wall to help guide me when I did my health assessment. I also have the form that I used to document my findings of my actual health assessment. So for those of you that are really interested and want the extra help, I'm here. Like I said, I'm in nursing education, and so this is something that I really enjoy and I want to do beforehand, before I even graduate from my master's. So yeah, thank you so much. And if you like this video, please go through the extra step and like it, and maybe I'll post some more. Let me know what you need help with, and I'll try to help you as much as I can. Thank you.